I've been with Platinum Home Healthcare since 2013. We've grown together from hundreds of patients to thousands. It's definitely not a stagnant workplace. We're learning, adapting, and changing every single day.
We've always been like one big family. I mean, even some of my own family members are patients here. Not only do we treat our patients like family, but our staff as well. We're in this together. Nobody gets left behind.
I feel everyone's ideas are valid. I respect my team, and if someone has an idea or an opinion, I want to hear it.
We try to give everyone opportunities to grow, building their education, helping them move up the ranks, get promoted, get more hours, and anything they need to be fulfilled. We're always looking to help each other grow and learn from challenges. We try to inspire each other. I mean, I can't even begin to describe how Lynette has inspired me personally. She's been through so much and still comes to work with a positive attitude. It's an example of who we all try to be to each other.
We are a team. We are connected by our passion for what we do. I go to work feeling valued, supported, and understood. And that's a rare thing to find in this world. I already know I will be a Platinum Home Healthcare team member for life. I know what I have, and I am not giving it up.
Working with Platinum Home Healthcare is amazing. I always feel so good knowing my team has my back. My coordinator, Hannah, is so supportive and always there if I have a question. And I'm doing something that makes me feel fulfilled, like I'm giving back to my community.
We're all connected here, with hundreds of people in our office and thousands of caregivers. That's not an easy thing to do, but we make it happen because it's important to us.
Everyone deserves to be treated with compassion, with intention. I go to bed at night at peace with myself, knowing that we have made a difference in someone's life, for our patients and our staff.
I'm proud to be part of the Platinum family. We share our lives together. We celebrate our success and comfort each other in bad times. I wouldn't have it any other way.
Platinum Home Healthcare is so much more than just a place to work or a place to get better. It's a place where everyone feels connected. It's a place that you can call home. Platinum is your home.
You're broken down and tired of living life on a merry-go-round, and you can find a fighter, but I see it in you, so we gon' walk it out and move mountains. We gon' walk it out and move mountains. And I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I'll do it 1,000 times again. And I'll rise up, high like the waves. I'll rise up, in spite of the ache. I'll rise up, and I'll do it 1,000 times again. For you, for you, for you, for you. All we need is hope. And for that we have each other. And for that we have each other. And we will rise, so we'll rise. Oh, we'll rise. I'll rise up, rise like the day. I'll rise up, in spite of the ache. I will rise 1,000 times times again. And we'll rise up high like the waves. We'll rise up in spite of the ache. I'll rise up and I'll do it 1,000 times again. For you, for you, for you, for you.
Mi carrera con Platinum comenzó desde 2013. Juntos hemos pasado de tener cientos de pacientes a miles. Se trata de un lugar donde puedes tener aspiraciones y objetivos claros. Aprendemos, nos adaptamos y cambiamos al diario.
Siempre hemos sido como una gran familia. Incluso algunos de mis familiares son pacientes en este centro. No solamente tratamos a nuestros pacientes como si fueran de la familia, sino también a nuestro personal. Estamos juntos en esto. Nadie se queda atrás.
Las ideas de todos son válidas. Respeto a mi equipo y si alguien tiene una idea, opinión, quiero escucharla.
Intentamos dar a todos oportunidades de crecimiento para que se formen y puedan ascender en su carrera. Siempre procuramos ayudarnos mutuamente a crecer y aprender de los retos. No sé cómo describir lo que Liné me ha inspirado a nivel personal. Ha atravesado muchas dificultades y sigue viniendo a trabajar con una actitud positiva. Es un ejemplo de lo que todos intentamos para hacer los demás.
Somos un equipo. Nos une la pasión por lo que hacemos. Acudo a mi trabajo sintiéndome valorada, apoyada y comprendida, lo cual es difícil de encontrar en este mundo. Ya sé que seré un miembro del equipo Platinum Home Health Care de por vida. Sé lo que tengo y no voy a renunciar a ello.
Aquí todos estamos muy unidos, con cientos de empleados en nuestra oficina y miles de cuidadores. No es fácil, pero lo hacemos porque para nosotros es importante.
Me voy a la cama en paz cada noche, sabiendo que hemos marcado la diferencia en la vida de alguien, tanto de nuestros pacientes como de nuestro personal.
Siento que este es mi sitio, que de verdad les importa lo que queremos, lo que pensamos y lo que sentimos. Es algo que nunca pensé que podría tener, pero ahora que lo tengo, no pienso volver atrás.
Platinum es mucho más que un lugar para trabajar o un lugar donde mejorar. Es un lugar donde todos nos sentimos unidos. Platinum es nuestro hogar.
Welcome to the Platinum Caregiver Day, a program full of excitement and rewards brought to you by Platinum Home Healthcare. Today, you will learn how to take good care of yourself, as well as win some exciting prizes. Meet our host, Geradline Collado, and watch as she interviews our amazing guests. First in line is Dr. Yao, who will teach us how to keep a healthy body and lifestyle. Our second guest is Carole Levine, who will help you discover how to maintain a healthy mind and a sense of fulfillment. Plus, some awesome prizes in the house. Are you ready for this? Here we go!
Dear Platinum Caregiver Day is a celebration of you, a small token of appreciation for all the hard work and dedication you show every day. One of the most rewarding things about being a caregiver is the fact that you will be able to help others on a daily basis. Through the services and support you are providing, you will be having a direct impact on the quality of life for your clients. This alone can make the hard work and dedication well worth it. Caregivers often sacrifice much of their schedules to care for others, even if it means a lesser quality of life for themselves. It's important then to understand that there are ways to provide without sacrificing your own mental and physical health. This starts with taking care of your physical health. Dr. Yang Yao is an accomplished PA, and I would like to take a second to introduce. Good afternoon, Dr. Yao. So tell us a little bit about yourself.
So I've been a physician assistant for many years now. I've been doing a whole bunch of primary care specialties, ranging from pediatric care to geriatric care and telehealth. I'm very passionate about helping out patients. I love working with home caregivers, home health aides, because they have a very, very difficult job. And it's not easy at all. It is brutal at times even. But it's great working with them and to kind of help deliver excellent care for the patients, for Platinum.
Awesome. And how long have you been in the medical field for?
For about 8 years now.
Oh, nice. Okay. So tell me, what could you say a caregiver should start their day?
So if we start at the very beginning, make sure they take care of this some sort of hygiene. Don't skimp out. Make sure they have a nice, hearty, healthy breakfast. Anything that's kind of with all the vitamins and nutrients, fruits, all that good stuff. Overall, my philosophy is having good balance, making sure that you're getting all the vitamins and nutrients you need, trying to avoid unhealthy stuff. Obviously, if you're making a transition to from what you're used to, make small adjustments so that your body gets used to it. Big changes are very difficult to accomplish and harder to even stick consistently. And obviously, if you're coming from a Caribbean culture, if you're coming from a South American culture, some of these things are still relatively healthy within moderation, and make some slight adjustments in terms of like adding maybe a little bit more fruits. And if you have complicating medical issues like diabetes, you also want to kind of balance that out. So you may not necessarily want to use any refined sugar. If you do have to take any sweets, although you should try to cut down a little bit, you want to make sure that you go with like something more natural, like honey. And like carrots, you'll be surprised. Carrots can be kind of sweet, and again, fruits and yogurt, because the yogurt also has probiotics, which is very important for your digestion.
What do you think about the typical American breakfast that we're all typically used to? Some good old scrambled eggs and bacon in the morning.
As yummy as that is, which I also love too, you want to kind of make some adjustments because like a lot of like cheeses can, if you eat too much cheese or like fried cheese with it, it can get converted to trans fat. There's some studies that show some association with Alzheimer's. If in terms of like processed meats, obviously you want to avoid that stuff because there's a higher rate of association towards cancer, especially when you compare it to like a vegan diet. There's like a wide difference. And so I would try to do more like egg whites, go a little bit more boiled, cut back on some of the salts, cut back on maybe the portion size a little bit, and maybe cut back like 10-20% in the beginning, so that it's not that aggressive. And then throw in a little bit of yogurt, a little bit of fruits, and a little bit more veggies. Like I like omelets with everything: veggies, tomatoes, and not just and a little bit of meat here and there sometimes. So yeah, I would say make those types of adjustments, and you'll still get kind of a little best of both worlds with a little more balance towards the healthier side.
All right, well, thank you for that information. So, do you really believe in this stuff? So, for me, for example, I grew up in a Dominican household, and we spent our upbringing eating mango. So, mango mostly consisted of fried salami, fried cheese, onions, and mashed plantains with butter. And I would say we turned out pretty all right from so far. So what's your take on that?
So yeah, I mean, I've had mango. It's delicious. I've been to DR multiple times. That's a beautiful country. I think in terms of, I would say like you can still like plantains are still relatively healthy. Maybe just a little bit less fried, and maybe a little bit more natural without as much frying, and making certain slight adjustments where you can still have your cultural food, which is delicious.
So what is the side effect if people continue eating this way?
So over the long term, when you fry stuff, you're more likely to convert the more easily the good fats into bad fats, trans fats. And that can then, over time, clog up your arteries, and worst case scenario, clog up the arteries to your heart, to your brain, and you're more likely to get a heart attack or stroke, or you hear about a lot of older Hispanics and older Blacks at a higher rate on average needing heart surgery. So you want to kind of make these little adjustments as you're younger and build a much better habit. So in the long run, you avoid that kind of potential higher risk outcome. It's okay to have your cultural foods. It's okay to have your have cheat days. There's nothing wrong with that. We're only human, and so you have them, but again, with moderation.
What do you recommend our caregivers should generally avoid?
So I would say on average, cut back on the fried stuff, cut back on too much really oily stuff, cut back on too much unhealthy snacks, too much stuff with too much salt, and replace it with a healthier snack option. These changes are not easy. So small little changes at a time, even if it's one less, let's say one less bag of chips, one less, or like half a strip less of bacon, or maybe you can instead, if you feel up for it, maybe a slight adjustment like boiling the bacon instead rather than cooking it straight up.
Okay, thank you, doctor. Speaking of a good diet, how about a good drink?
So since we're mostly 70% water, definitely I encourage people to drink water. And during the hot summer months, obviously it's your body's naturally going to want to drink more cold water. I wouldn't chug it, sip it, kind of slowly sip it throughout your work shift for caregivers. It might sometimes be difficult, especially if there's a lot to do. But if you have, as a reminder, to kind of remember to kind of drink a little water, you can have it place a bottle of water nearby where you're working, so that as you're passing around, you'll see it, and then you're more likely to drink it. Because when you're very busy, you kind of forget to feed yourself, forget to drink. So these little reminders can help.
Would you say juicing is healthy?
Yeah, you're bringing a lot of vitamins and potentially minerals as well, and it could be almost like a meal replacement at times, which then especially the convenience of it, right? If you're in the middle of your shift as a caregiver, you're so busy. You don't feel like you have time to kind of sit down, heat up the meal. So having like a shake made from various fruits can be very healthy. In terms of like juicing, make sure you don't use the processed ones. Make sure it's best to buy the fruits, put it in a blender yourself. Obviously, make sure you deskin whatever needs to be deskinned, because processed juices usually are like only a few percentage in terms of actual natural juices, and they don't have as much fiber, and you need the fiber too as well. Fiber has the benefit of absorbing some of the bad cholesterol and preventing your body from taking it and clogging up your arteries.
Anemia is very common, also diagnosis. What would you recommend for juicing with people with anemia?
Make sure that you get a good amount of vitamin C that helps your body absorb the iron better. If you wanted to, I would say you can try to put in some red beans maybe. You can mix it in. Beans have a good amount of iron as well. And depending on if you like the taste or not, although if you put in a little bit of honey, I think that makes almost everything taste good.
Okay. All right. How many glasses of water should you say a caregiver should have in a day?
Depending on their environment, at least probably 4 cups and maybe upwards of 8 cups. So when I say 8 cups, if they're like, let's say in an apartment that's hot, sometimes you can't control the temperature as well as you want to. So I would drink more water and leaning more towards the 8 cups. Or if they're cleaning a little bit more as well, it's a little more active with that patient. They have to, help them walk more, stuff like that, lift them up more.
To our amazing caregivers, our heroes, here is a self-care kit that was already shipped to all of you all. This was handpicked by the best team in the world, all right? Inside, you have everything you need to just wind down after a long, hard day. You are so appreciated and deserving not only of this, but all the great things that come your way each and every day. I cannot thank you enough. I appreciate you. I salute you. And I'm here for you. We're all here for you. Platinum Home Care. And last but not least, if you take a picture upon receiving this amazing kit and post it on our social media website, you'll be entered into our prize giveaway. And the prizes is a nice, relaxing spa day. So feel free to post a picture below. We can't wait to see all your cool photos with these amazing self-care kits. All right, so you had a healthy breakfast. So what's next on a caregiver's agenda?
So if you can, try to put in some time to exercise. You don't have to go crazy, especially in the beginning if you're not used to it. Little tips and tricks could be like, for example, on your watch, or if you're tech savvy on your cell phone, set like an alarm. Every hour as a reminder, do some quick exercise. What
would you say are quick, simple exercises for a caregiver?
Yeah, sure. So I have a philosophy that everywhere is a gym. So maybe if you kind of steal away and then maybe like you find a chair, you could do some dips, a few repetitions there. You can do some push-ups, some jumping jacks, arm raises.
How quickly should a caregiver exercise after eating?
Definitely wait a good 30 minutes, let your body digest. At the very least, you can do a little more walking. Don't just immediately sit down. Definitely don't lie down because you can increase the chance of some reflux, and that's not going to be fun.
Could you exercise before eating breakfast?
Yeah, if you prefer your routine to more exercise before breakfast, that's definitely very common. When I was in the military, that's how it was done, and most elite athletes also act like that. A little bit of water to stay hydrated, or if you want like sports drinks, whatever, and then get a nice good workout routine before breakfast. Yes, that's definitely on the agenda.
Would you say it's true that it's for a nice, healthy overall diet, it's 70% of what you eat and 30% of what you work out?
Probably, yeah. I mean, that's definitely fair, yeah.
Day to day, our caregivers face hardship of challenges with our patients, and with your experience in the field, I'm sure you had many challenges with your patients. What piece of advice would you give our caregivers during these challenging moments that they endure with their patient and they just want to just walk out?
So I think one of the most important things is making sure that they take care of themselves. Their health, their mental and physical well-being is super important. If they're not at their best, they can't be expected to deliver their best. And if they're not healthy, they can't share with our patients a quality and a level of service that they really do deserve. And it's not easy, especially if you have to deal with like dementia patients. And I mean, like, even let's say, depending on the type of caregiver you are, if you're a home attendant versus, let's say, a home attendant that's also their primary caregiver, that's your family, right? It's very difficult to escape that. So sometimes you do need a respite, and that's okay. Sometimes you do need a little venting. That's okay. You deserve that, and it helps you recharge. So allowing to kind of do these things where you allow yourself to focus, a little venting here and there, socializing. Don't stay into yourself. Broaden out, open up. Our society is becoming basically a caregiver society, because the average age is getting older. We live longer, so there's a lot more people with a lot of wisdom to share with us, that you can learn from and make your life easier even.
Back to, you mentioned dementia. A lot of our patients actually have dementia. And, all of our caregivers have families with dementia. What insight would you give that people should know about dementia?
One, I think, is having, whether it's your family or not, I think it's really, really important to love the job, love the tasks. Put yourself into it in a certain sense. You don't have to sacrifice everything. That's not healthy either. But when you're approaching it with love, it won't feel as much of a burden. Even if you're going out of your way, it will feel very rewarding. And
what would you say is the misconception behind dementia?
They're not. I think the misconception is they're not trying. The patient isn't trying to do bad things, right? Their brain isn't at its best anymore, so they're very reactive, and learning to kind of be patient and learning to kind of to think about how, from their perspective, like they're scared a lot of times. They don't know what's really going on, and they don't have their full facilities to kind of interpret things correctly. So the natural thing is only two reactions: fear or anger, and it can get very aggressive. So don't take it personal. That's probably one of my biggest advice.
Okay, thank you. In terms of a caregiver providing the most exceptional quality care, what should they do daily in reference to their patients? What's a must-do when it comes to providing quality care to their patients?
Getting to know them in terms of their medical needs, and staying organized, with a routine. In the beginning, you may not have a clear routine yet, but you can work with the family to kind of figure out what has worked and what doesn't work. Jotting down on a nice list. You can write it in your cell phone. You can put it on paper, whatever you feel most comfortable with, and then kind of doing your best to try to stick to it for the most part. Routine helps provide patients a certain sense of expectation, and it feels way more comfortable when you know what you can expect.
How often should our caregivers see a doctor?
Depending on their level of health, it could be at least once a year to several times a year. So if you have a lot of medical issues, I would definitely see a doctor and other specialists and other supporting allied health professionals probably every few weeks to every couple of months.
So, being that 80% of our caregivers are females, what would you recommend in terms of their health?
For women's health, that's at least every couple of years, sometimes depending on their level of sexual activity and partners. The more partners they have, I would actually say once a year to do a pap smear, see their gynecologist. If they have other complicating factors related to their women's health, they can bring on other specialists, like even a urologist. If they have, let's say, if they're pregnant and they're a high-risk pregnancy, they can also look towards like a midwife. That can also be very, very helpful, and subspecialties within obstetrics, where it's a high-risk obstetricians. They can provide a great deal of wisdom on their well-being, especially when you're pregnant and it's high risk. Let's say you're 38, 39, and you're having a baby, and you have to take care of patients. It's that stress alone can have an impact on your health.
I find caregivers struggle also with their mental health. What are the resources for them in making sure their mental health is as equally as good as their physical health?
So luckily, nowadays it's not like back with our parents. There's a wide range of resources, from free provided by the government to obviously being paid by your insurance as well. Sometimes you have to pay a little bit out of pocket. But like you can see psychologists, psychiatrists, you can join groups, local community groups on, let's say if you're savvy, on meetup.com to look for groups within your neighborhood or your borough to see who you can talk to. Sometimes you can also ask for visitors. There's help in like transportation. There's sometimes free, now of course it's the government, so it may not be perfect and it's not going to be on your schedule, but you can work around it. Have patience, definitely, and lots of online resources. Caregiving.org is a great online resource. There's a plethora, and to kind of just like go out there and spend a little bit of time every day to kind of like research this stuff is very, very helpful.
Thank you. Speaking of mental health, what's your take on meditation?
Yeah, it's very, very useful and helpful, and meditation can help reduce your long-term stress. There's some studies association that it can reduce your blood pressure over the long term as well, especially if you're very consistent about it. I am a very big proponent of it.
Any quick techniques you have on meditation?
So in the beginning, sometimes it's very difficult. I would actually recommend watching like some YouTube videos. Personally, I watch this YouTube influencer called Lavender. She guides you through a meditation or relaxation period. And her voice is amazing, so relaxing.
That's funny you say that, because I actually have trouble sleeping. So I YouTube a sleeping meditation, and I'm out like a baby within the next 5 minutes. So I definitely could agree with that with the meditation on YouTube. Nice.
Mm-hmm. Yeah, I can see also like sometimes if you're stressed as a caregiver, sometimes you might have trouble sleeping. So yeah, trying something like that would also be very helpful. And working it into your routine, you can make it at the beginning of your day, at the end of your day. You can even do prayers if you're more on the religious side. That's because fundamentally you're basically trying to be at peace. And all that will have very strong beneficial results on your physical body as well.
Yeah, because they say if your mental health is not intact, then your physical will be off as well.
Exactly. So if you were to schedule into your schedule for meditation, you can start with a few minutes, 2 to 5 minutes a day in the morning, maybe as soon as you wake up. You can maybe even do it maybe a few minutes during your lunch break if you have time. You can do it maybe or a few minutes before you go to sleep. Sometimes, if you like, you can do it with your partner, with your family. It's always nicer when you do it together and make it a little more social.
In your own experience, have you seen any changes after people began their incorporating meditation in their lives? Yeah,
for me personally, like when, especially during my first couple of years as a clinician, it's always very tough. That burden of responsibility, you don't feel it until you're in the thick of it. And so I started, researching ways on how to kind of reduce my own stress. And over time, as I built a strong regimen of meditation and relaxation to kind of take care of myself, so that I can then take care of patients better, I noticed that my stress over time slowly went down. No need to go into vices, no need for alcohol, meditation.
We all know how stress could be very overwhelming to a person's body, but how harmful could it be to our caregivers?
Oh, at its worst, stress can literally kill you. So whenever you have you're in a stressful situation, your body releases hormones that can shrink and decrease your vessels that feed the blood into your heart, into your brain, and other parts of your other important organs of your body. Literally, a heart attack is basically your vessels completely shrinking down to the point where no blood goes to a certain section of your heart, and you have a heart attack. So maintaining a low stress or balancing out your stress is really, really important to your long-term health.
So people could really die from stress?
At its rare and worst case scenario, yes, it is definitely possible.
I tell my staff whenever they feel stressed out that it's good to just stop for 30 seconds and just breathe in and out, and it helps.
Yeah, absolutely. That's a great suggestion. I remember when I was in the psychiatric ward helping take care of medical issues, because psychiatric patients also have medical issues. So we have a child unit, and sometimes they can misbehave. So one of the things that we would encourage them to do if they feel stressed out is not punch the wall, but if they need to physically kind of release some of that stress, punch the mattress, punch the pillow, so they don't injure themselves. And it's a release. These are
I saw that on the show once.
Natural.
Yeah.
Oh yeah.
Yeah, grab a bat and just punch it on the pillow.
Oh, a bat?
Yeah.
Okay, that's intense, but as long as they're not hurting anybody.
Yeah. Okay.
Stay tuned till the end so you can win some exciting prizes.
Hi, I am your Platinum Home Care representative. Today, I'm going to demonstrate how to clock in and clock out using interactive voice response, or IVR. Please note you must use the client's phone for clocking in and clocking out. Otherwise, you will not be able to register your time. If you have any questions related to registering your time, please contact your coordinator. For the purpose of today's demonstration, we will be using a non-registered assignment ID 123456. To direct your call in English, dial 718-705-9464. For Spanish, dial 718-705-9465.
Welcome to HHA Exchange. Press 1 for call in, press 2 for call out.
After the prompt, press 1 to clock in for your visit, followed by your assignment ID number.
Enter your assignment ID.
The system will then request confirmation. Press 1 to confirm your assignment ID, or press 0 to re-enter.
You have entered 1, 2, 3, 4, 5, 6. If it is correct, press 1 or press 0 to re-enter.
The system will inform you that you have successfully clocked in.
Your call has been successfully registered.
Next, we will be demonstrating how to clock out using IVR. Before clocking out, Please verify all duty IDs associated with the tasks you have performed during your visit based on the plan of care. For English, dial 718-705-9464. For Spanish, dial 718-705-9465.
Welcome to HHA Exchange.
After the prompt, press 2 to clock out. Enter your assignment ID, PIN, and press 1 to confirm.
Press 1 for call in, press 2 for call out. Enter your assignment ID. You have entered 1, 2, 3, 4, 5, 6. If it is correct, press 1 or press 0 to re-enter.
After confirming your ID, the system will prompt you to enter the duty ID. Every visit requires a minimum of 7 tasks from your client's plan of care or task sheet: 2 personal care, 1 nutrition, 1 medication, 3 more per your client's plan of care. Attached is a sample. Please contact the office if you can't locate your client's plan of care or task sheet.
Enter duty ID.
Enter all the duty IDs of the plan of care or task sheet you performed during the visit. For example, enter 111 for dressing. Enter 201 for diet prescribed. Enter 117 for toileting. After you have entered all the duties for that visit, press 000 to complete the clock out process. After you have entered 000, the system will inform you that you have successfully clocked out for your shift. Please note you must use the client's phone. For any questions, please contact your coordinator.
We all know how much work our caregivers put out in the world. They are our main frontliners. What to you would you say makes caregivers so special?
I think that dedication and just giving themselves to being able to help them manage their life effectively, and making sure that their patients are very healthy, making sure that they're happy, well fed. I mean, that is such a, in my opinion, such a high calling that I think they're basically like heroes.
Yeah. Caregiving to me is very personal. I've had family members that have been caregivers their whole entire lives, and all of our caregivers at Platinum are very dear to our hearts. I love you all so much. You are the epitome of a hero, and our world will be absolutely nothing without y'all. What's the most important meal in a day for a caregiver?
I would say breakfast is the most important meal, and sometimes a more American and Western style thinks that dinner should be the most important meal. It tends to be a lot heavier. You probably shouldn't, because you'll end up like sleeping on it and not using the nutrients, and you'll store it as fat a lot of times. Our going out culture also forces us to have late dinner. That's not necessarily healthy.
I read before that you're not supposed to eat after 7.
That is very important to not eat too late, because if you eat too late and then you go to sleep, the food's going to sit there, and sometimes it can push back up and cause you long-term reflux. I've experienced that, and many Americans probably have experienced that. But it also kind of depends on when you wake up and go to sleep as well. If you're waking up a little bit later and you're also going to sleep a little bit later, you can make certain adjustments. As long as you're not eating within 2 hours of going to sleep, it should be acceptable.
What about a late night chip?
Oh, like the munchies late at night?
Yeah.
Oh,
some candy, some potato chips.
Yeah, I've definitely been guilty of stuff like that as well. It's hard to fight those cravings. But again, if you have to, sometimes you can have a little bit of a cheat. But I've noticed that I was healthier if I did those late night cravings. I had like a little cereal and maybe some almond milk, or obviously you can have regular milk if you're not lactose intolerant.
Yeah, and some moving popcorn.
Yeah, I mean, yeah, popcorn is delicious, especially, I don't know if you like spicy popcorn or like maybe like the more sweetened popcorn.
And the more butter, the better.
Yeah, more butter.
You know?
Yeah, that's all delicious stuff in moderation. Like maybe, maybe like once or twice a week tops.
All right, that's not bad.
If you can't fight the urge to kind of to have something more crunchy and you love chips, there's also healthier versions of those chips. Look for chips that have less trans fat. Sometimes there's vegetable chips, and they'll also even have some vitamins as well in there. Same thing.
So
for
what's a
popcorn
good
as
fat
well.
and what's a trans fat?
Good fat is, when you're reading the nutrition label, we'll say monosaturated fats.
I'm personally guilty of late night snacking. Personally, my favorite is Twix. I don't think there's a good healthy replacement for that one.
Yeah, I have a big sweet tooth as well. Yeah, Twix is also one of my kryptonites, and ice cream, probably Snickers and like all that stuff.
We try to avoid our patients' hospitalization. What's the advice for caregivers to avoid their patients going to the hospital?
So sometimes it can be a little bit tricky, and it's understandable if they want to err more on the side of caution and call 911. Things that are definitely 911 worthy is if your patient passes out, and bumps their head at the edge of a table, especially a sharp table, and that you can't wake them up. If you've been trained to check their pulses, right, check their wrist pulse, check their neck pulse, if that's basically gone, yeah, you have to save their life. Things that are more in the gray area is a lot more nuanced. It definitely takes a certain level of experience. Some things you could try to do if you feel comfortable with it is you can try to get a telehealth specialist online, a doctor, and then see what they think. That can be relatively quick. And other kind of tricks that I would use in terms of navigating the gray zone is, are they able to kind of still talk to you logically? Are they still kind of breathing comfortably? Do they look like they're like really out of it? If they look really sick, and they're holding their chest, let's say, and it's not just like they're feeling really anxious, right? Then you probably want to start, thinking through like, hey, did they take their medicines? If they didn't take their medicines, maybe they need to take their medicines. That can easily just solve the issue. Maybe they accidentally forgot. Did something just happen that can easily explain it, and it's not very dangerous? For example, let's say they were watching TV and they just got very scared, right?
Yeah.
Not a big deal. If there was just a loud noise, something from the outside, maybe like a muffler exploding or something like that, or a motorcycle revving really, really loud, and that just like startled them, and kind of just got them off their usual routine. Not a big deal. So there's some judgment call. It'll take some experience. When you're on the lighter side of the experience, it feels like you want to call for everything. I would say try to lean a little bit away. Think about if it's very dangerous. Obviously, if they have a lot of medical issues too, right? The nature of your patient's condition can also weigh into the math, to the calculus of all this. So if they have a lot of medical issues and they're starting to look a little bit bad, then yeah, then it's understandable to kind of lean more towards calling 911. But if you have a little bit of time, it could help to call their primary caregiver, call a telehealth specialist, and get them to give you a second opinion, maybe even sometimes their family. If you have a good working relationship with their family, they may give you some insight, but like, oh, that sometimes that happens, but it's nothing dangerous.
Dr. Yao, a lot of our caregivers deal with elderly patients. A lot of them are not also alert oriented, and they trip and fall many times. What advice would you give to prevent falls?
So for our caregivers, some of the things I would definitely do is make sure the lane that your patients tend to travel with is as clear as possible. Hopefully the family can also work with you, make sure that there's more carpet, so that if if they do fall, they don't fall into a hard surface. Making sure the footwear at home is not slippery as well. You want to have easy to put on and non-slippery slippers. Other things like making sure that their cane or walker is close by. If they're ready to move, obviously be there to kind of help them lift up. Don't bend over too much, you're gonna hurt your back. Make sure you help use your knees, especially if they're coming from a very low position, a lying position or a sitting position. If like, let's say they need to use the bathroom, right? Sometimes it's helpful to maybe consider having a commode, especially if they're so unstable and weak that like sitting down, getting to the toilet is an arduous journey. Making sure that a commode is nearby can kind of reduce those risks as well. Medications can also increase your chances of falling. So things like gabapentin, medication that compensates for your high blood pressure. So within the first hour or so of taking those medicines, patients are at the highest risk of falling, especially if they're elderly. So those times I would say be more cautious. You might want to encourage the patient to kind of be more in the sitting positions and try to be more relaxed until their body readjusts, and then they can start moving around.
We also have a huge caseload of children of special needs. How can a caregiver give the best ultimate care for a child that, let's say, is autistic? Routine
and trying to not take it personally. Having good routine will help them be on a certain schedule so that they don't feel uncomfortable and they know what to expect. And depending on along their spectrum, some of them may be more on the lines of very, very active, ADHD, very hyperactive. So make sure that they got their medicine. If they need to have their own little special routine to feel comfortable, incorporate it. Be a little bit flexible on that matter, because then once they're a little more comfortable, then they won't kind of spiral out of control and make your life a little more miserable than it has to be. So I think that's kind of like where the philosophy should be. Is it true that it throws them off whenever there's changes in caregivers when it comes to attending a child with special needs? Yeah, absolutely. Again, that goes to like their comfort with the surrounding. Anytime there's no consistency, that definitely throws things off for them. They're gonna more likely misbehave, and it's not like they're being malicious about it. It's unfortunately the nature of their psychiatry and their emotional state. It's not as well developed. You have to think that it's at a younger age, and so they don't feel comfortable, they don't feel secure, so they're going to express it out. Thank you. Well, Dr. Yao, it's been such a pleasure. You have given us so many information, so many tools for our caregivers to take with them from this day forward. It's been a pleasure having you here with us today. The honor was all mine, Geraldine, and I want to thank all the caregivers and all the home health aides for their wonderful job. It's not easy, and I'll try to get your back whenever I can as well. Thank you. And we also would like to thank Mr. Katz from Viva Health for the introduction of Dr. Yao.
Stay tuned till the end so you can win some exciting prizes.
I've been with Platinum Home Healthcare since 2013. We've grown together from hundreds of patients to thousands. It's definitely not a stagnant workplace. We're learning, adapting, and changing every single day.
We've always been like one big family. I mean, even some of my own family members are patients here. Not only do we treat our patients like family, but our staff as well. We're in this together. Nobody gets left behind.
I feel everyone's ideas are valid. I respect my team, and if someone has an idea or an opinion, I want to hear it.
We try to give everyone opportunities to grow, building their education, helping them move up the ranks, get promoted, get more hours, and anything they need to be fulfilled. We're always looking to help each other grow and learn from challenges. We try to inspire each other. I mean, I can't even begin to describe how Lynette has inspired me personally. She's been through so much and still comes to work with a positive attitude. It's an example of who we all try to be to each other.
We are a team. We are connected by our passion for what we do. I go to work feeling valued, supported, and understood. And that's a rare thing to find in this world. I already know I will be a Platinum Home Healthcare team member for life. I know what I have, and I am not giving it up.
Working with Platinum Home Healthcare is amazing. I always feel so good knowing my team has my back. My coordinator, Hannah, is so supportive and always there if I have a question. And I'm doing something that makes me feel fulfilled, like I'm giving back to my community.
We're all connected here, with hundreds of people in our office and thousands of caregivers. That's not an easy thing to do, but we make it happen because it's important to us.
Everyone deserves to be treated with compassion, with intention. I go to bed at night at peace with myself, knowing that we have made a difference in someone's life, for our patients and our staff.
I'm proud to be part of the Platinum family. We share our lives together. We celebrate our success and comfort each other in bad times. I wouldn't have it any other way.
Platinum Home Healthcare is so much more than just a place to work or a place to get better. It's a place where everyone feels connected. It's a place that you can call home. Platinum is your home.
Stay tuned till the end so you can win some exciting prizes.
All right, caregivers, here are the top 10 tips to have an amazing, efficient day. Tip number 1, make sure you catch up on your Z's. Get a good night rest the night before your shift, all right? Tip number 2, eat a hearty breakfast before going to work. You do not want to arrive to work with an empty stomach in pain. No. Tip number 3, always wear a clean and neat uniform. Tip number 4, look up directions the day before your shift begins. You don't want to be lost in a maze before your shift. Tip number 5, when you get to your patient's house, make sure you put your phone on vibrate. We are already distracted as it is with the outside world, so only answer calls if it's an emergency. Tip number 6, review your patient's plan of care to ensure that you are providing the ultimate quality care. Tip number 7, I know this could be very challenging, but never, ever argue with a patient or a family member. We are here to assist you, to mediate. Just feel free to email us at hr@platinumhhc.com. Tip number 8, engage with your patient. Get to know them. Act like you're going on a date. It'll just make your day just move faster and you might learn something new. Tip number 9, be patient, be flexible and understanding. Just relax and let loose and don't take things so serious. And last but not least, take care of yourself today and every single day. Dear Platinum Caregiver, we can share with others resources that we lack ourselves. A critical starting point is to take our own mental health temperature. How am I doing? What will help me combat anxiety? Am I drinking, eating, or sleeping or crying too much? What do I need to do to stay connected? Now, I'm so thrilled to have our next guest here, Mrs. Carole Levine. Mrs. Levine, a licensed psychotherapist, deals with a lot of elderly patients just like you, caregivers. I'm so thrilled to have her here today. Ms. Levine, thank you for joining us. Could you tell us a little bit about yourself and what you do?
Sure. I've always had an interest in the elderly. For many, many years, I volunteered in nursing homes, and then I became a psychotherapist, and I started working with the elderly in an assisted living facility and in nursing homes. I've worked with the elderly's family and the elderly people themselves. I run groups with the elderly, and I have a special affinity for the elderly. I enjoy working with them.
What would you say makes them so special?
Well, they're a sort of neglected part of the population. They don't have a lot of exposure. People in American society don't have a lot of respect for the elderly in general. And I noticed that when they're given attention, the best of them comes out, and there's a lot that can be gained from knowing them and befriending them.
Is it true that as people get older, their mindset kind of goes back to when they were like a child?
Well, it's more usually if they have dementia.
Okay.
The dementia causes them to have a worse short-term memory, markedly worse short-term memory, and at that point they retrieve into their childhood, and their childhood memories come to the fore. Now, if those childhood memories were very negative, such as those of Holocaust survivors, then they live in a very, very horrible place. And I've had that with clients who are living in those days, and they've repeated to me some of their awful memories. If they didn't have such awful experiences, then their childhood memories could actually give them joy and pride, and that's something that we try to bring out in them when we talk to them.
What would you say would be the best quality care caregiver could provide to these particular elderly patients?
Well, it depends what their job description is. If they're doing physical care, emotional care, psychotherapy, physical care is probably the hardest, and that requires a lot of self-care. Emotional work is a little easier, but that requires more knowledge because it involves reminiscence therapy, narrative therapy, and there are different ways to do that, and it involves some education.
Mrs. Levine, why would you say elderly people are the most neglected population?
Well, in American society, elderly are put out to pasture, and their value is undermined. They're often put into assisted living facilities and nursing homes with little attention and are neglected in that way. Their minds, because they're somewhat receding, are considered not with it, quote unquote, and they begin to feel this way themselves. They begin to feel that they have no sense of purpose. And that's part of my job, to let them know that they do have a sense of purpose and they are valued for who they are and where they've been, and that experience and wrinkles are a sign of respect and pride.
Absolutely. Now, going back to dementia patients, how can a caregiver release the stress of dealing with dementia patients? How can it be less stressful for them? Because I know it could be challenging, especially with sometimes they could have these outbursts. What would you say helps most when dealing with elderly patients that have dementia?
Okay, so there are several points that have to be made in what you're talking about. First of all, they need support. I know at Platinum they get that kind of support. Not always do caregivers get enough support. They need self-care. As you mentioned before, they need to make sure they're sleeping enough, eating enough. If the stress gets too high and they're not sleeping enough, then they need to see their doctor to figure out a way that they could get more sleep. Depending on how many hours they're with the patient, the longer their hours, the more self-care they need. They may need respite care, time away from the patient. The hours could be cut shorter so that they're not with them for that many hours. They need help, such as there being such as the patients being with a daycare program for the elderly, or some other kind of outings, maybe someone else from the family taking them out for walks, or other additions to and other resources to help them cope with this very difficult task. We very much appreciate the staff the caregiver staff at Platinum, because we know what a hard job they're doing, and we try to offer as much support as possible because of that understanding. They also need maybe support groups, maybe even outside Platinum, so they could get, the studies show that the health of caregivers is somewhat compromised because of the difficulty of dealing with people with dementia specifically, and they need to be aware of that and make sure they're getting the top medical care and keep an eye on their health so that their health doesn't deteriorate as a result. Sometimes their self-esteem is threatened because of the dementia patients who criticize them, insult them, and they need not to take it personally, knowing that they're doing the best they can with the tools they have. And they need to be aware of their thoughts as well as their physical condition in order to cope with those stressors.
Right. And for you caregivers, if you ever have any challenges in finding these resources, please feel free to contact HR@platinumhhd.com. We will gladly provide you all the resources, all the support you need to help you be a better caregiver when dealing with dementia patients. But it's normal, right, to be frustrated after enduring the symptoms from a patient that suffers from dementia. Would you say so, Ms.
Sure. The main point of frustration is the fact that there's usually no progress. If anything, with dementia patients, there's deterioration. So you could be doing everything right, and still you might see deterioration, and that's not the caregiver's fault. It doesn't mean that the caregiver is not doing a good job. The nature of dementia, unless it doesn't happen, if luckily it doesn't happen.
That's interesting you say that, because, I feel like as humans we struggle in making sure that we're doing everything right. So when we see that something's not going the way we are, especially being as a caregiver, being in the field that they are, and if they don't see any progress, they think, well, I'm to blame, and then they start questioning themselves. But in fact, it's like a no end game. It's just making sure you're just there to provide support not only for the patient but for you as well.
Right. So that undermines the caregiver's self-esteem and sense of accomplishment. But the fact that they're, as I said, doing the best they can with the tools they have, which the Platinum caregivers do have a lot of tools, they still are not going to see radical improvement in their work with the patient. They will see that they have a calming effect on the patient if they learn the responses that they could have when the dementia patient acts out verbally or physically. There is a lot of techniques that they could use to calm them down, and in that way they'll know that they're doing well. And they can also help the relatives and the family of the patient to learn those tactics and techniques so that they won't they'll have tools to work with them. The caregivers can also be a liaison between the patient and the family.
Yeah, so they most certainly are.
Right, so they could cope better with the patient's outbursts.
Well, in my experience in Platinum, a lot of our caregivers experience challenges, sometimes more with the family members than with our patients. So what is your suggestion with dealing with micromanaging family members?
Okay, well, a good idea that we use in the facility and with the work that I do is that we have family meetings.
Okay.
With as many people involved as possible. In other words, members of the family are encouraged to come, and any other professionals that are dealing with the patient are encouraged to come. And these are very effective in knowing what can be done to help the family cope, and to acknowledging the fact that the family is going through a difficult time, to validate their feelings, to encourage them to contribute, and to let them know that we appreciate their contributions. We know how hard it is for them. We explain to them that there might be some role reversal, some sense of loss, which contribute to their trying to micromanage the situation.
So you would say family meetings incorporating also the physicians that take care of the patient?
If possible.
Okay.
The psychiatrist, the neurologist, whoever it is that's involved. If it can't be done personally, it could be done by Zoom, if they can't come down.
That's a great idea.
Stay tuned till the end so you can win some exciting prizes.
Hi, I am your Platinum Home Care representative. Today, I'm going to demonstrate how to clock in and clock out using interactive voice response, or IVR. Please note you must use the client's phone for clocking in and clocking out. Otherwise, you will not be able to register your time. If you have any questions related to registering your time, please contact your coordinator. For the purpose of today's demonstration, we will be using a non-registered assignment ID 123456. To direct your call in English, dial 718-705-9464. For Spanish, dial 718-705-9465.
Welcome to HHA Exchange. Press 1 for call in, press 2 for call out.
After the prompt, press 1 to clock in for your visit, followed by your assignment ID number.
Enter your assignment ID.
The system will then request confirmation. Press 1 to confirm your assignment ID, or press 0 to re-enter.
You have entered 1, 2, 3, 4, 5, 6. If it is correct, press 1 or press 0 to re-enter.
The system will inform you that you have successfully clocked in.
Your call has been successfully registered.
Next, we will be demonstrating how to clock out using IVR. Before clocking out, please verify all duty IDs associated with the tasks you have performed during your visit based on the plan of care. For English, dial 718-705-9464. For Spanish, dial 718-705-9465.
Welcome to HHA Exchange.
After the prompt, press 2 to clock out. Enter your assignment ID, PIN, and press 1 to confirm.
Press 1 for call in, press 2 for call out. Enter your assignment ID. You have entered 1, 2, 3, 4, 5, 6. If it is correct, press 1 or press 0 to re-enter.
After confirming your ID, the system will prompt you to enter the duty ID. Every visit requires a minimum of 7 tasks from your client's plan of care or task sheet: 2 personal care, 1 nutrition, 1 medication, 3 more per your client's plan of care. Attached is a sample. Please contact the office if you can't locate your client's plan of care or task sheet.
Enter duty ID.
Enter all the duty IDs of the plan of care or task sheet you performed during the visit. For example, enter 111 for dressing. Enter 201 for diet prescribed. Enter 117 for toileting. After you have entered all the duties for that visit, press 000 to complete the clock out process. After you have entered 000, the system will inform you that you have successfully clocked out for your shift. Please note you must use the client's phone. For any questions, please contact your coordinator.
We all know the positive thinking, how the outcome that it has on our environment. What would you advise our aides to keep positive?
Okay, well, the first thing is we said self-care. That's very, very important. If you can't be positive on the inside, you can't be positive on the outside. Number two, to practice self-statements that you could make so that it comes out in the way you act. For example, like I said, I'm doing the best I can with the tools I have. Number two, I have support if I feel overwhelmed or stressed out. Number three, what this person is doing has nothing to do with the fact that I'm not doing a good job. Number four, this work can be very rewarding, and part of it is. It's very important to me to know that I'm doing what I'm doing. I am helping this patient deal with the ravages of their disease. Dementia is an illness, and they're suffering. I need to remember that. They're sick and suffering, and whatever I'm doing is only helping them. Even though they may not see it that way, but I know in my heart that what I'm doing has tremendous value and is really, really making them feel better.
That was beautiful. Is there any correlation between a good diet and mental health for our caregivers?
Definitely. Studies show, the Mayo Clinic has shown that a caregiver needs to pay special attention to her diet, making sure that she takes the time to prepare and eat her healthy diet, and maybe even go to a nutritionist to make sure that she has a food plan that she sticks to in caring for the elderly. Generally, a caregiver spends hours with the patient, and therefore she tends to be subsumed by the caring of the elderly and just forgets to eat. I've heard caregivers who at 4 o'clock remember they didn't eat today, and that puts them at a very big disadvantage.
What meal would you say is most important for the caregiver to have?
Breakfast, a good, nice, wholesome breakfast. Start the day in a healthy way.
How many meals do you think they should have throughout the day?
Definitely lunch breaks, and I hope they're home for dinner and they have prepared before what they're going to have that's nutritious and satisfying.
Mrs. Lee, I once read that sometimes when people, even, including our caregivers, indulge in snacks, stuff that isn't healthy could sometimes be a downer mood-wise, and when they eat healthy foods, their mood is much more vibrant. Is that something that you are familiar with?
Yes, definitely. That's why I suggested a food plan, which is thought about at the beginning of the day or when the caregiver is doing food shopping, which includes a healthy protein, low-fat, healthy, not fried starch, and a healthy vegetable at meals during the day. Like I said, a food plan is the best way to do this, because to concentrate on eating at the time that you're hungry is not going to work. You'll just take a cup of coffee and a bag of
So you
potato
recommend
chips.
meal prepping?
Yeah, definitely. It's very hard to do it at the time that you're hungry.
Right.
And there are foods that takeout is not a good alternative, because it's very hard to make good decisions when you're standing in front of the array of food that they have there. If you have no choice, then I guess try to find a takeout place that gives a choice of fresh salads and healthy proteins rather than heavily fried food. Okay, there is a therapeutic effect actually for the caregivers to cook for themselves, choosing the ingredients and deciding what to make and to cook it even when they come home from work. Gives them some time to get back to their own selves. And even another option is to have one of their loved ones at home prepare the meal for them while they sit and drink a cup of tea. That could be even more therapeutic if they have someone available to do that.
Well, I don't know how therapeutic it is to do the dishes afterward.
Well, maybe they could get someone to do that too.
Oh, well, that's true. You hear that, caregivers? Teamwork is dream work. Is there like a deadline as far as when the last time a caregiver should eat?
Meaning to say
time of the day?
Well, usually not after 8 p.m.
Okay. What's the reason behind that?
Because it's very hard for the body to digest when a person goes to sleep. It's an added toll, takes an added toll on the body. It interferes with sleep, so it's better to stop all eating at 8 p.m.
And speaking of sleep, how many hours should a caregiver sleep?
It varies. Everybody's different. Some people can burn a candle on both ends and sleep very little. Some people need a full 8 hours. So it really depends. They have to know what their body needs and meet those needs accordingly.
What's the average amount of?
Average recommended is 8 hours.
Okay. Now, what are your tips for our caregivers as far as exercise or meditation?
Definitely exercise has a great benefit. Studies have shown that caregivers often experience depression. And depression is ameliorated by the exercise, which raises the serotonin level in the brain, and therefore it could affect depression and anxiety, which are two possible reactions to heavy caregiving. And the way one exercises can be joining a gym. Outdoor walks are very
or dancing.
Beneficial, or dancing. That would be great.
Right.
And it's best if it's done every day at the same time, so it's part of the caregiver's schedule. This is time that he or she needs. It's not a luxury, it's a necessity in order to be, as we spoke about, positive with the job that they're doing.
Would you say it's best for them to exercise before they provide the services? Because sometimes, would you say they're probably burnt out by the time their shift is over?
Right. If they can manage it in the morning, that would be the best. If they're night owls, it's okay if they do it at 8 p.m., as long as they get it in.
What would you say is a good mental health exercise? Or is the physical movement equivalent to helping also stimulate the mind?
You mentioned about meditation. That's
Yes.
another very helpful tool for caregivers to have. There's many different forms of meditation. Yoga is one form of body work and meditation, which is very helpful. Then there's mindfulness, which is very helpful. These are all skills that a person could learn either on YouTube or in books.
I hear
or on
breath work
DVDs.
is actually pretty good in maintaining composure when you feel like you may overreact. Because I know sometimes they deal with challenging patients, so it's hard to just, calm down. And breath work, I hear, is really good a form of meditation.
Yeah, that is a very good form of meditation that you could do right on the job.
Yeah.
Okay, also yoga can be done in group classes, either at a gym or formed by the yoga teacher herself, and that includes socialization, which is also a big benefit for caregivers.
So would you say it's helpful for them, the caregivers, to socialize also on a daily basis outside of what they do at work?
Definitely. Socialization is one of the main components of handling stress.
So how important is socialization, Mrs. Levine?
Okay, socialization with other people is very important. It gives the person an opportunity to just vent and air out their feelings and just have a good time. Going out for coffee with a friend, or going to an exercise or yoga class with a friend. Going to other forms of recreation with a friend is always better than going alone. It just makes a person feel like they're a part of something other than just their caregiver. They have other roles and other strengths.
Sometimes, even for me, it's challenging to vent, especially feelings. Would you say journaling would be good as well?
Yeah.
As a form of releasing?
Yeah, journaling is great as a form of releasing. So is a best friend, though.
Yes, for sure. How can our caregivers be better? Because there are always room to be better in providing a good relationship with elderly patients.
Okay, one thing that really helps is asking them about their childhood.
Really?
Yeah, and about their, even if their childhood was not so pleasant, they want to be heard. They want their years to be appreciated. And there's even something called reminiscence therapy, where you encourage them to remember hopefully good memories And there's even a value, which I'm doing with someone right now, in them writing their memoirs. In other words, they dictate and you type or write their memoirs, and then they could share it with their family. They might be
kind of like
shy.
the movie The Notebook.
Yeah.
You ever seen that movie?
No.
It's about an older lady. She has dementia, and she writes out, before it gets worse, she writes out her whole life story and tells her family to read it for her anytime she is going through a downer.
That's very valuable. Also, it could be done with photos, make a photo collage of past happy memories that they've had, and that will strengthen the quality of the relationship between the caregiver and the patient.
That's a great tip. You hear that, caregivers? Make sure you socialize, and if you're not able to socialize, make sure you write down your thoughts. They're extremely helpful.
Stay tuned till the end so you can win some exciting prizes.
To our amazing caregivers, our heroes, here is a self-care kit that was already shipped to all of you all. This was handpicked by the best team in the world, all right? Inside, you have everything you need to just wind down after a long, hard day. You are so appreciated and deserving not only of this, but all the great things that come your way each and every day. I cannot thank you enough. I appreciate you. I salute you, and I'm here for you. We're all here for you. Platinum Home Care. And last but not least, if you take a picture upon receiving this amazing kit and post it on our social media website, you'll be entered into our prize giveaway, and the prizes is a nice relaxing spa day. So feel free to post a picture below. We can't wait to see all your cool photos with these amazing self-care kits. Now back to you, Mrs. Levine. Speaking of the benefit of socializing, how about benefits of a pet? What would you say are the benefits behind having a pet?
Okay, it's beneficial for both caregivers and elderly patients. Studies have shown that people who have a pet, it brings out their nurturing emotions. It makes them feel like they have a companion. Especially dogs are very devoted and loyal to their owners. The patient and caregiver can choose which kind of pet they want to have, but it's good if they find out before they buy it that it's been trained to be more loving than aggressive. And caring for a pet is in itself beneficial because it takes away from the stress of caring for a caregiver, because pets are much easier to care for than a patient.
Yeah, I always say they'll love you unconditionally.
Right, right.
Mrs. Levine, what would you say is a better recommendation as far as caregivers and who they socialize with? Is it better for them to associate themselves with people in their field or people that are outside the field, or a combination of both?
Okay, what you last said is what I would recommend, a combination of both. First of all, they need support. So that has to be with other caregivers like them. A support group would be the best. I don't know if Platinum has it, but if they could provide one within their domain, that would be the best.
Right. And for you caregivers, know that we always have your back, and we'll be working on creating these support groups for you. Look out for further information. Stay tuned.
And second of all, they need socialization outside of their work, just with friends or family, that just takes them away from the stresses of the work that they're doing. Fun activities, family get-togethers, anything that they enjoy doing, either with friends or family, activities that they enjoy, barbecues in the summer and skiing in the winter, whatever it is that they enjoy. But the main thing is that it should be done with other people so that they don't feel alone and they feel supported by the people that they love.
What about hobbies for our caregivers? Did that contribute to their mental health?
Definitely. Definitely, that's one of the tools that a caregiver could use to make them feel better and give them good mental health. The main thing about a hobby is that it should be pleasurable. It doesn't have to be goal-oriented. In fact, it's better that it's not goal-oriented. something that they enjoy. They may try new things and give it some time, but if eventually it's not proving pleasurable and it just feels like more work, then that means that they shouldn't be doing it. They don't have to do it with other people. If they rather work on their own, that's fine, as long as it gives them pleasure. Now, the problem is that caregivers sometimes are so caught up with what they're doing that they lose track of what gives them pleasure. So they need to be reminded, and by their supervisor, that they need to be looking for pleasurable activities that they once had or that they want to pursue at this point. At any age, this is important. Even for the patient themselves, pleasurable activities are important, and they could even do pleasurable activities together if they both enjoy it. If the patient is musical, so they could be encouraged to play music if the caregiver enjoys it. So that's the main focus that the caregiver should have in pursuing a hobby.
Sometimes a person's hobby could be negative. So, for example, sometimes partying brings them pleasure. What's the effect of alcohol and substance abuse?
Okay, that's a very important question. Substance abuse is pleasurable in the short run, but in the long run it damages their health, and it also creates problems with their work. I've seen people who are caregivers who actually show up at work drunk. And if that's the case, they don't do their job well, and their supervisors are not happy with their work, and they're in big trouble. They don't deal well with the patients, and in the end, they're not happy with themselves. So that's not a good hobby.
Right. And what effect does it have in the long run?
Well, that's really the biggest danger, that it messes up a person's mental health. They just can't function as well in the short term, and in the long term, there are people who have been addicted to substances and their cognitive abilities are seriously jeopardized, and they don't function well, and this is a permanent loss. It's not a temporary loss, so they really don't want to go that route.
Right. So at one point, does it become excessive? At one point, can a caregiver notice when it's no longer at the pleasurable but more of an abuse level?
Okay, that's a very good question. Being able to take a drink at a party and then go home and sleep it out is okay. The problem is when it gets uncontrolled, when a person needs a drink to overcome the headache that they have from a drink, and a person is not thinking about anything else all day except getting back to that drink after work. When it becomes a craving, a daily, nightly craving, at that point they know they're in big trouble.
So what would you recommend, Mrs. Levine, for a caregiver going through that situation?
Okay, the most widely recommended treatment for people with substance abuse is Alcoholics Anonymous. That's usually weekly meetings in which alcoholics share their successes, first their weaknesses and then their successes in combating alcohol abuse. There are also Al-Anon meetings, which are family members of people with substance abuse that might be relevant to some caregivers because that's a big stressor and they might need that. But they really work. They really work. Their saying is, it works if you work it. So it involves work, but people find that they've been abstinent for years, as long as they keep it up and they come to meetings or even on Zoom. But it really helps, reading from the book, having sponsors. It's a program, but it really is the most effective thing that works for abuse, substance abuse.
That's very fascinating. I also read that hobbies help a lot with coming out of addiction.
Right, that's 100% true, because a person who's avoiding substance abuse is going to need something else to fill that vacuum, which is why a lot of people who give up alcohol become addicted to sugar or even cigarettes. So they need something to do that they could do instead of their giving in to their cravings. In fact, AA encourages people to make a list of things that they can do when they're having a craving. And as many things as they could think of. It might be going for a walk, like exercise, which is number one on the list, or a walk outdoors, would be even better. They might take up boating in the nice weather. They might take up fishing, something that they haven't done before that gives them a thrill, but a healthy kind of thrill.
It's funny that you mentioned cigarettes, because cigarettes, doesn't it cause lung cancer?
Yeah, cigarettes causes lung cancer, but there are a lot of people out there who it seems that they really don't care about it. There are even people I've seen in nursing homes who have heart failure and they're smoking like fiends. So the addiction is very, very well documented.
Would you say someone in addiction does not care for themselves?
I wouldn't say that. I would say that it's an addiction. It's their body is craving it. It's not their mind. It's really an illness. At AA, they call it an allergy. So I don't think it's in the mind. I think it's the body has become addicted to it.
How can a caregiver recognize he or she is addicted?
Again, if the cravings are not allowing them to stop, then they're addicted.
Mrs. Levine, what's your recommendation on quitting to smoke?
Well, I know that there are groups, again, anonymous groups for quitting smoking, but there are people who can do it on their own. I know of people who have stopped cold turkey because their cardiologist told them that they have black on their lungs. They saw on various x-rays. So and I know of people that have stopped as a result of that. I know of people who stopped because the girl that they were engaged to said, "I'm not going to marry you unless you stop smoking." I want to emphasize, though, that we do validate and sympathize with the fact that caregivers really need an outlet. And sometimes they're in the middle of a difficult moment and they just need to get out and have a smoke break. But we encourage them to learn, like you said, breath work and other ways of calming themselves and giving themselves a pick-me-up so that they don't have to revert to smoking.
Right. We're all humans, Ms. Levine. We make mistakes. I know our caregivers, every now and then have a fair share of their mistakes. When these mistakes happen and it's a bad day, what's your advice for them?
Oh, that's a very fair question. We all know that people make mistakes and caregivers are no different. They're not superhuman. The trick is not to be pulled down by one's mistakes. The trick is to get up and try again the next day, to regret what they did, to learn how to do it better next time. There's always a way to do it better for everybody. And try
accountability?
Accountability, definitely, but also recognition and trying to think of how to do it again better next time so that it doesn't happen again. That's the most we could hope for. And again, validating the caregiver's feelings. Rather, she can validate her feelings and her attempts to do it as best as she can and give herself pep talks. She really needs it.
Agree. Speaking of mental health, when it comes to people enduring the fact that they might need medication or they're struggling, whether it's mental or physical, how can we get a person back to that mindset to want and be acceptance of the help?
Okay, that's a very good question and very important. The healthiest thing a person could do is to do whatever they can to be healthy, whether it's medication, therapy, seeing a psychiatrist, and there's no reason why they have to be ashamed of this. It's actually very praiseworthy of them. They could have a lot of self-respect for doing what they're doing. They don't have to share it with other people if they don't want to, but they should just know deep down inside that they're doing the best that they could do, and this is actually laudable and praiseworthy, and keep that in mind. And if they're concerned about the finances, a lot of times these things are covered by insurance, so they just have to do a little research, and that aspect of it won't be so daunting.
So, Ms. Levine, following up on addiction, would you say social media could be addictive?
Definitely, and it's becoming more widespread with passing time. It's especially problematic when they're on their cell phones while they're working, which, if it's addictive, they can't really control it. And it's happened. I've seen it happen. I've seen aides be on their cell phones, and as a result, it's detrimental to the elderly people that they're working with. They just don't pay attention to them. And I've had a situation where I was running a group, and the aide, I invited one of the elderly to come join the group, and the aide said, no, she's not coming, because she wanted to be on her phone, and she didn't want to bother with bringing the aide to the group. With bringing the patient to the group. So it definitely undermines their effectiveness as a caregiver. There is help for people who are addicted to their cell phones or social media in general. They can get help from therapists who specialize in this kind of addiction, and they definitely should be encouraged to do so.
Thank you so much, Mrs. Levine. I appreciate your time once again. What is your final message for our caregivers?
Thank you for the opportunity to be here and meet with you, Geraldine, and I want to give a message to all the caregivers that we really appreciate your efforts at benefiting the elderly in our society, especially in a society, as we said, that doesn't necessarily cater to the needs of the elderly as they deserve. And it's sometimes a thankless job, but it's very worthwhile and hopefully rewarding in the long run. And just give yourselves a pat on the back as often as you need. Thank you.
All right, and we'll be right back to announce the winners for Platinum Caregiver Day. See y'all all in a minute. All right, everyone, welcome to Platinum Home Healthcare Caregiver Day. Whoop, 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 whoop. So we got some awesome prizes, all right? Ain't no prizes out there like these. So first we have these ear pods, okay now? These are the latest version, because we don't do old versions, of the AirPods, 3rd generation. Here we have an iPhone, all right? If you want to call your mom, your dad, your boyfriend, your girlfriend, whatever apps you want to use is right here. And here we have the Galaxy tablet. Whoop, whoop, whoop. It's pretty much the computer that you can just take with you anywhere you want, right? So let's see who the lucky winners are. Yes! All right, so first winner of these AirPods goes to, drum roll please, Araneli Pais Perez! Yes! You are the winner of these cool-ass AirPods. Okay, can nobody bother you from this point on when you have these on? All right. The next winner to the second pair of AirPods goes to Roxana Bueno! Yes! Can nobody do like you with these now, girlfriend? All right, now, and our second to last prize of this iPhone goes to Gloria Jalil! Woo! All right, and last but not least, the winner of this awesome tablet goes to Angela Gonzalez! Yes, Angela! Thank you so much to all the caregivers. Well deserved. But wait, there's one more prize. A $50 Amazon gift card. Oh my God. All right, so the winner of this $50 Amazon goes to, drum roll please, Cristal Campo Collins. Yes! Once again, thank you to all the winners. You are the best ever. We love you so much. Thank you for all your hard work. It never goes unnoticed. Have an awesome day, not only today, but every day. Thank you so much to all of our Platinum caregivers. You could have been anywhere in the world today, but you're here with me. I've learned so much today. I'm sure you have as well. And as a token of our appreciation, we have created a website specially just for you, which includes all of your resources, all of our giveaways that we have for you, our caregivers. We love you. Please make sure to look into our website at platinumhha.com. Have a good night, and I'll see you next time.
You're broken down and tired of living life on a merry-go-round, and you can find a fighter, but I see it in you, so we gon' walk it out and move mountains. We gon' walk it out and move mountains. And I'll rise up, I'll rise like the day, I'll rise up, I'll rise unafraid, I'll rise up, and I'll do it 1,000 times again. And I'll rise up, high like the waves, I'll rise up, in spite of the ache, I'll rise up, and I'll do it 1,000 times again. For you, for you, for you, for you. All we need is hope. And for that we have each other. And for that we have each other. And we will rise, so we'll rise. Oh, we'll rise. I'll rise up, rise like the day, I'll rise up, in spite of the ache, I will rise 1,000 times again.